My name is Sarah Knudsen, and I am the medical planning director for the incident command team for the hospital's response to the COVID pandemic.
The question I have about COVID-19 is, why are the tests different? One has the swab that goes in the nostrils, and one has the swab that's in your cheeks.
So when we think about COVID testing, there are several techniques, and certainly the testing has tremendously evolved since the early days. As everyone is aware, the nasopharyngeal swab, which is the deeper swab, was the original gold standard test for diagnosing COVID infection. We still do use that test regularly at the hospital setting as well as in the outpatient clinics and urgent care. However, there are a couple new types of tests that have come onto line, which are very useful to us, in that oftentimes they are less uncomfortable to administer, or they deliver a more rapid test result. So in the case of the mouth swab, it's also called the buccal swab. This is a test which is in every other way exactly like the regular nasopharyngeal swab in terms of it's a PCR test. It's generally a mail out. The test results are not available immediately. However, the technique of obtaining the specimen is quite a bit different and much more comfortable, especially among children or really anybody. So generally, the patient is asked to do some vigorous coughing, and then there's a swab that's placed within the mouth itself, and the specimen is obtained from the inside of the cheek with some vigorous swabbing, but not any more deep than that, so it's quite a bit more comfortable. More recently, there is a new, what's called a Binax antigen test, and that is just a nasal swab. So again, it's a much more comfortable swab to obtain. This is a test where results can be available, almost like a home pregnancy test. The results will be available quite rapidly. One thing to remember about that test is it's only useful in the first 5 days of symptom onset. And additionally, it's not 100% sensitive. So it's often useful more as a surveillance screening test, or a test that can, when positive, is useful, but when it's negative and the clinical situation is compelling, then the confirmatory test needs to as well be obtained. Like with any medical procedure or medication, it's always recommended that you speak with your primary care doctor to answer any of your questions that you might have, or any special considerations that might apply to you as a patient.